Okay.
I'm going to ask a few questions about anxiety disorder. So first and foremost, I would like to ask you about the definition of anxiety disorder.
Okay, Amani. Anxiety is a normal reaction to stress and can be beneficial in some situations.
Okay, so what are actually the symptoms that we can see that usually the patients portray?
Okay, there are many symptoms. These are fatigue, difficult in sleeping, impaired concentration, and maybe excessive anxiety and worry.
Okay, I think there are many symptoms that we usually see to. Next, I would like to ask if you have ever experienced encounter a patient who is going through this disorder.
Okay, yes. In fact, there are a lot of them because most of them are not diagnosed with severe anxiety disorder. Usually, students in upper form are most likely to have anxiety disorder due to stress and pressure from the teachers and parents.
I certainly agree with that because during my high school years, also I got a lot of pressure during important examination like PT3, SPM. So I really can relate to those who are going through this disorder.
Yeah.
So last but not least, my question is, can you give some advices and tips on how to handle this anxiety disorder?
Okay, my advice. First, the person should seek help from your loved ones or close friends because they are someone who you can trust and guide through your hard times.
Yes. Thank you, Kartini, for this sharing.
The short sharing.
Short interview.
Short interview.
So I hope you guys would be filled with a lot more information about anxiety disorder. With that, I end this interview with thank you.
Okay, you are welcome, Amani.
So, I'm going to explain briefly about the types of anxiety disorder that I've learned. So, the first one is generalized anxiety disorder. This disorder, you will feel excessive, unrealistic worry and tension with little or no reason. Next, panic disorder. If you are having this disorder, you will feel sudden, intense fear that brings on the panic attack. During a panic attack, you may break out in a sweat, have chest pain, and have a pounding heartbeat, palpitations. Sometimes you may feel like you are choking or having a heart attack. So next is social anxiety disorder, also called as a social phobia. This is when you feel overwhelming worry and self-consciousness about everyday social situations. You will obsessively worry about others judging you or being embarrassed or ridiculed. Next is agoraphobia. Agoraphobia is when you have an intense fear of being in a place where it seems hard to escape or get help if an emergency occurs. For example, You may panic or feel anxious when you are on an airplane or public transportation or standing in line with a crowd.